exercise. This is a great little exercise program that we often give people to start with in the early stages with shoulder problems. Of course, if you're watching this, it might be also a good idea to watch some of the neck exercise videos that we have, because obviously having good posture is a big influence on shoulder problems. But the first exercise that we like to start with, of course, remember all of these are done in conjunction with any other stretches or anything else that we might give you. But the first exercise that we generally give is what we call the scapular squeeze, sometimes known as the no monies, or the squeeze backs, or whatever you want to call it. Okay, so basically with this exercise, I'll turn sideways so you can sort of see. Again, adopting a really good posture, standing up nice and tall, or sitting up tall if you do it sitting down. Imagine the old helium balloon on top of the head there. I like to do it with my palms up, and then we squeeze back like so as we're doing it. And what that does is it activates all the muscles between the shoulder blades that fixate the shoulder girdle in towards the spine. And basically we squeeze back and hold there for a few seconds, and then relax. Squeezing back, holding for a few seconds. That could be anywhere from 3 to 5 to 10 seconds, and then relaxing. Of course you can do 10 reps of these or so. Sometimes we give this to people to do in the car, and we call it wheel taps or steering wheel taps. So imagine the steering wheel here, I've stopped at a red light, I squeeze back and pull my hands back away from the wheel, or sometimes people even just still hold onto the wheel, squeezes the shoulders back, and then they come forward, tap the wheel, and then squeeze back again. Sometimes you can even squeeze and hold there throughout the whole duration of a red light. Of course you can couple that with any neck exercises that you may also be doing. So that's a great little exercise to start with. The next exercise that we like to use to control what the scapula is doing in your shoulder girdle and shoulder injury is what we call the clock exercise. Now here's a little clock that I've drawn for us, for those of us who don't know what a clock looks like. When we do the right side, we tend to go clockwise. When we do the left side, I find it best to go anti-clockwise. And basically what that does is it just sort of helps us activate the muscles appropriately. So at the 12 o'clock position, basically you're in a nice comfortable arm reach away. You don't need to be at a full arm reach. I like a nice comfortable angle so that we're a bit more relaxed through the whole shoulder, and not trying to hold the arm up using all these upper trap muscles and levator scap and everything like that. So basically we start at 12 o'clock. And that's just a neutral position where we're in a good posture. As we go around to 3 o'clock, I like to squeeze the shoulder blade back towards the spine. So basically squeezing directly in through all these muscles down the inside of the shoulder blade. We hold that for a second, and then as we go down to 6 o'clock, we still keep squeezing the shoulder blade back, but then we also depress the shoulder blade down. Now notice when I'm doing that, I'm keeping my back nice and straight. I don't go out to 3 o'clock and sort of turn a little bit. I don't go down to 6 o'clock and tilt. Okay, we come around to 3 o'clock, squeezing the shoulder blade, down to 6 o'clock, anchoring it straight down and depressing the shoulder blade. As we come across to 9 o'clock, basically we're trying to resist the shoulder wanting to come forward like so. So it's almost the opposite of 3 o'clock. So as we come right down around, we come back up to 9 o'clock where we're just anchoring the shoulder blade back, and then back up to neutral at 3 o'clock. As we get better, of course, we can go faster and faster with this exercise and smooth it all out so it's a nice smooth circle rather than sort of acting like a bit of a diamond or squaring off the corners. So we start at 12, working our way around to 3, squeezing the shoulder blade, depressing down at 6 o'clock, so we're depressing the shoulder blade, across to 9 o'clock, anchoring it again, back up to 12 o'clock at neutral. And we just keep working our way around and down and across and up. And you'll have to do quite a number of repetitions. This is a coordination exercise. Any coordination exercise, it just involves a huge number of repetitions in order to get benefit from it. In this case here, you might start with, say, 10 to 15 reps and build that up to 20, and then start to do some more difficult things that we can show you down the track. The next exercise that we often give people in this case here is what we call a scapular push-up, which is utilising the scapular muscles to keep the shoulder blades anchored towards the rib cage. One of the big problems people have with shoulder injuries is they get winging of the shoulder blade, and this is an exercise to help counteract that problem. So we stand at an elbow distance from the wall. I like to just use the elbows rather than sort of putting the wrists on the wall, so I like to just hover the wrists off the wall ever so slightly. The elbows are at a nice comfortable angle. not lifting up like so, just keeping them back at a neutral position, watching what position our head's in so that we don't sort of start moving around too much. And basically we drop in towards the wall, pushing our chest directly towards it, keeping the shoulder blades down, and then we squeeze away from the wall, making sure our shoulder blades are squeezing and all the muscles around on the medial border and underneath the shoulder blade are anchoring that shoulder blade to the rib cage. So we drop in, really controlling the movement, and then we push away, squeezing the shoulder blades, making sure our shoulders stay down and don't end up near our ears. And we work up and down nice and slowly with that movement, again, to build control of the muscle and build coordination of our shoulder blades so that we've got better fixation of the scapula, which is going to help with most of our shoulder injuries. With that one, as we get better at it, of course we can stand back and do it with our full arm length, okay, as we get a bit more coordinated. The reason we don't start with that is often people would do little push-ups instead of actually keeping the arm straight and utilising the shoulder blade when they're doing it. Alternatively, you can do single arm exercises with that one, where we stand. I'd like to put a hand on the chest there just to control my movement, dropping in, pushing away, dropping in, pushing away as we do that. Exactly the same movement, except it's only happening on one side or unilaterally, so that way we can just really sort of target one particular shoulder if you've got a singular shoulder problem. Again, as we get better at all of those exercises, to make it more difficult, we can start to go on more angles in that we can start to come further away from the wall and really get a lot more body weight into the wall, or alternatively we can use a table or a bench or such, and you can work like so, and again that's going to put greater levels of gravity as you get more and more horizontal to actually stabilise those shoulder blades. Inevitably the goal is to get into a push-up position and be able to perform that exercise. Lots of people do push-ups as an exercise, but unfortunately a lot of people who are doing those have shoulder problems and basically aren't able to fixate this shoulder blade. So the push-up actually starts to become a bit of a counterproductive problem in those cases. So as with any of these exercises that we give you, regardless of what region it's for, if you have any problems with them, make sure you give us a call. If they cause any pain, once again, make sure you give us a call if you're worried about your technique or anything like that, and either chat to us or make an appointment and get in and see us as soon as you can.